Well, what an honor to be here with this panel and with all of you. Several familiar faces, and yes, Jim and I have been really working together, even though in different offices, for 22 years. And my soul brother here, Dr. Brenner, for 6 years. And Kim, it's great that we've been at the center for several years. We started volunteering at the center, and we've been now on staff as acupuncturist. But talking about PCOM and acupuncture, it's just such an honor to have several of the senior students come to the cancer center and be part of the family helping the patients. So integrative oncology is, everything has been said already. I'm probably going to repeat what the other speakers have mentioned, but integration is really bringing everything together that can help the patient. So cancer is a complex illness. Daniel mentioned a lot of really wise things about cancer, and it's complex. There's a lot of research. Thousands of, maybe millions of researchers throughout the world are looking at cancer and how to understand it, how to treat it. There are so many researchers that devote their life to help cancer patients, and it's important to honor that. Any of you who's been in a lab or working in a lab, these people sometimes don't sleep because they're trying to find an answer. So science, research is advancing. There's a lot of information that we gain in the medical community and in all communities that are working in healing. So we need to work together. And in a humble way, we understand that none of us have the answers. So as medical oncologists, we do our craft using the medicines we have available, but that's just a piece of the puzzle. Any patient with cancer, the integration is using the best that medicine and science has to offer, but bringing in the wisdom of the ages and of the sages throughout humanity. And traditional Chinese medicine really has eons of years of experience. So for us at the Cancer Center to have the medical part, but integrating in the wisdom of PCOM and the practitioners of Reiki, Qigong, meditation, mindfulness meditation, all the different forms of meditation, so many different energy healing traditions, and yoga. There's a whole list of disciplines that have profound power that will help the patients have an improved quality of life. And what we do see is when the patients have the options to experience different traditions and integrate them in their life, in their cancer therapy, we know they'll have an improved quality of life. But then many of them have a prolonged, they do live longer with an improved quality of life. And one of the things that we've talked about a lot with the group of integrative practitioners, not only in our center, but I would say in San Diego, is each and every one of us here we have our own experience, our own craft, our own art. But ultimately, it is the way that we approach the cancer patient, the way we are with them, the intention, the compassion, the connection. All of you here, when you're dealing with those who have cancer, if they're a client, a patient, a loved one, a family member, a neighbor, a friend, you're helping them profoundly because of your connection with them. I will ask Dr. Brenner to tell us about entrainment later, because it really is key to healing. And if we are in a very good place ourselves, and we are working on our own healing, and we have this connection with the patient, they will feel that strength. We are being an instrument for them to feel empowered to make the best decisions for themselves, to really honor their journey. And cancer is a journey. And a lot of people are cured but never feel healed. And many people feel healed and they're not cured. So ultimately, our goal, none of us are going to come out of this life alive, right? So our goal is the quality of life and to feel that true healing. And for us who work with hospice, I know Dr. Sinclair and Dr. Brenner worked with hospice for many years. And there are many people who are dying and they feel completely healed. And they feel connected to their soul, connected to God, connected to the universe. And they live their life. And the best we can do is to be with them and support them and not find answers for them, because each and every patient has their own answers within. So I just want to say that the integration, there's this great book edited by Drs. Donald Abrams and Andrew Weil, has dozens of expert practitioners, physicians and PhDs who talk about their own art in integrative oncology. But it really is, we're coming together, honoring what each one does, and respecting what we do. We have different training, different experiences, different techniques, and we want to honor that in each other and work together and in our case, tell a patient, this is the medical treatment, but you should also go to see Kim, see Dr. Brenner, see Dr. Jacobs, who's there, who does incredible work with applied kinesiology. I want to honor you, Dr. Jacobs. Can you raise your hand, please? Yeah. And so many, all of you, with your craft, your art, your intention, your love, your desire to help the patients, that's what they need. And we really honor you for being here, and just a great opportunity for us to learn from each other. Thank you.